Hi, I'm Dr. Steve Greene from Advanced Dermatology and Laser Institute of Seattle. It is April 2020 and we are in the midst of the Covid-19 virus pandemic. This is the most serious medical crisis of my entire career. Never before in my entire life have I been an eyewitness to a pandemic, a medical crisis that affects so many people locally, nationally, and internationally. This has been a source of stress, both from a medical standpoint, in a financial, personal, unsettling standpoint, that has created an uptick in skin conditions that we're actually seeing in dermatology. Because dermatology is the specialty of hair, skin, and nails, the largest organ of the body, I feel well suited to talk about those conditions that are really increased in nature, in severity, and in frequency, and I'd like to cover those things today. During these times of stress, we are under pressures, new pressures, in ways that we've really never experienced before, both in our home life and in the workplace. People are being sent home to do their work online, and we're trying to find new balances in our personal life, our family life, at the same time trying to be productive in our work responsibilities. And this is very hard for most of us, and to do it well. We have financial uncertainties. We're not sure if our jobs are going to even exist in the next 30 days. We're now having to provide homeschooling for our children, either in conjunction with programs in the schools or creating our own new programs of education for our children. We're having adverse effects on our normal circadian rhythms, which are so important in a lot of the stress hormones that are normally in check, so our blood pressure is higher. When there are disruptions in our circadian rhythm, this has a direct effect on our immune system. And what happens is it has actually an immune suppressant effect. So this puts us at greater risk for infections. So this has some direct effects on this pandemic and exposure to potential viruses in the world that we live in. Also, by impact and changes on our circadian rhythm, it causes changes on our nervous system. This increases our experiences with itching in the skin. We start to scratch at the skin. We break down our skin barrier, which puts us at greater risk for exposure and penetration through our skin of bacteria and viruses. This new anxiety is paralleling flares of many and most of our skin conditions that patients are experiencing. Our basic skincare routines, including hair care, nail care, as well as skin care, have an impact not only on managing conditions that are chronic in nature requiring that maintenance care, but it also impacts our self-image and how we look at ourselves. And this has impacted a lot of personal sensibilities as well as how we feel about ourselves in the working world. Now I'd like to cover some really important skin, hair, and nail conditions that are aggravated during times of stress and specifically during this time of skin hygiene accentuation and increased attention because of the COVID virus pandemic. First case is that of irritant contact dermatitis, a common condition in its own right. However, we're seeing a lot of cases at this time because of increased washing of hands due to harsh soaps, high alcohol content, hand sanitizers and cleansers. People are cleaning their kitchen counters at home, trying to make as clean surfaces as possible, and they're at risk for inflammation and rash on their hands. The next condition I'd like to share with you is a common condition, but we're seeing an increased incidence of this, one called rosacea. This is a genetic condition seen commonly in our patients of Western European origin. However, we do see it in all ethnic groups from all over the world. We're seeing cases of increased incidence in people who are working from home. They are reconfiguring their work, and they're tempted to change their dietary habits, and they're eating more spicy junk food, and they're going to grab feel-good foods that are high in carbohydrate, high fats, high spice, and they're also drinking more alcohol. And I just heard that alcohol sales are up 200%, and all these ingredients aggravate rosacea. Our next clinical condition that we're noticing an uptick in is acne vulgaris. Acne vulgaris is a common condition of the sebaceous gland, and we were talking about earlier how people are getting out of their normal routines of taking care of their skin. Here's another example of a patient seen in our practice, actually one of our medical assistants who was in a solid acne strategy program where her acne was in complete remission. However, during the stressful times, she lost incentive to follow through with all of her treatments, and she had a great setback and a flare of her acne condition. The next case I'd like to highlight is one of Acne Mechanica. This is a condition where a person is at risk for acne. However, when there is occlusion of the skin for long periods of time, and this could be over certain skincare products, and a good example of this in the modern age that's quite relevant is where people are wearing masks to protect themselves from exposure or the spread of the COVID-19 virus. Wearing masks for long periods of time will cause undue occlusion and acne to spring up just in the area of the face that is in keeping with the size and shape of the mask. The next case I'd like to highlight today is one of atopic dermatitis. Atopic dermatitis, of course, is a genetic condition. It's one of a deficiency in the skin of an ingredient that is responsible for holding on to water. We notice that when there is this lack of holding on to water efficiently, as in these patients with atopic dermatitis, the immune system is invited to try to solve the problem, and this contributes to inflammation in the skin, causing the rash, increase in scratching due to itching, skin breakdown, secondary bacterial infections, and because of lack of proper moisturizing with skin emollients, there can be an unsettling or out of shape microbiome where good bacteria are not able to keep in check the bad bacteria that overgrow, such as staph or strep in the skin, and this can cause secondary bacterial infections. Our next case I'd like to highlight today is that of psoriasis vulgaris. Patients with psoriasis are at risk of flare during dry seasons of the year, the fall and the winter months. But those patients who are not moisturizing adequately, especially those who are using in greater frequency harsh drying soaps, will get flares of their psoriasis. Also, we know that when people are reaching for those snack foods that are high in carbohydrate and fats, and also those who are drinking more alcohol, they will also develop flares of their psoriasis. The next case I'd like to highlight is one of generalized urticaria, or hives. And urticaria is a common condition. It can occur in 1 in 4 individuals sometime in their lifetime. Here was a case of an individual with urticarial raised plaques on the lower back. And this example also was induced in someone who was having to work from home, and also greater stress because of balancing home life, child care, education, and also we unveiled an association of thyroid disease and sensitivity to shellfish. The next case I'd like to highlight is one of lichen simplex chronicus. This is a condition caused by itch, scratch, itch. And this is usually seen in individuals commonly on the back of the neck or on the lower extremities, usually on the side of the body of the dominant hand. And patients will get more itching when they're under stress. And during the COVID virus pandemic, people are under greater stress, worrying about financial uncertainties, and they're itching more, scratching more, breaking down the skin barrier with open sores and excoriations, increase in secondary bacterial infections, and more problems with this condition. Let's now talk about examples of hair loss associated with the COVID virus pandemic. Telogen effluvium is a common cause of hair loss. We notice too that mostly patients might lose up to 100 hairs normally per day, but in telogen effluvium, patients will lose maybe 300 hairs a day with generalized diffuse hair loss, and this is caused by a change in the ratio of growing hairs, where an individual will have up to 30% of their hairs going into the telogen phase, which is a rest phase, and will notice clinically diffuse hair loss. This condition can last 3 to 6 months when it is active, and in those patients we will recommend a good healthy dietary guidance and healthy supplements which support hair growth. The second hair loss condition I'd like to highlight today is one of called alopecia areata. There is a theory in patients who suffer with this condition that it is brought upon in individuals who have a genetic predisposition for it, as well as a sensitivity to all causes of stress. I've seen this in patients who are under stress from work, stress in losing a job, stress in financial instability or uncertainty. During this pandemic, people are worrying a great deal and suffering from sleep deprivation, and this is certainly a great cause of stress in many of these affected individuals. Finally, I'd like to mention a cause of changes in the nails, one called Bowes lines. Bowes lines are a transverse depression in the nail plate, and we can see this during times of psychologic and physical stress in individuals. This can occur in one or all 10 fingernails. You can have one transverse line or multiple transverse lines. This can last for months, and it represents truly a retrospective indicator of psychological or physical stress in one's life. So during this time of increased stress that is influencing in a negative way common dermatology conditions during this time of viral pandemic, what are the strategies that we can immediately incorporate into our lives to prevent as well as reduce the severity of these conditions? Let's talk about that now. The first thing that we should include in our stress management program would be to learn and incorporate techniques such as yoga, meditation, exercise, and a return to nature. Bringing nature into our lives has a very soothing, restful possibility. Start a garden or get back to your garden to bring it back up into a beautiful shape for our lives. If there are things that you enjoy doing that give you joy, such as reading, such as walking your dog or walking with your family or with friends, certainly at a distance, reincorporate those things back into your life because they're very meaningful and they go a long way. The next thing I'd like to bring up is the importance of sleep and rest. And during this time of stress, during pandemic, sleep hygiene becomes all the more important. So turn off your computers and your cell phones at least 30 to 45 minutes before bedtime so that our mind can start getting into the right mode for more restful sleep. We want to maintain regular routines in our life and habits, keeping up with our daily skincare routines, including the care of our hair, skin, and nails, and incorporating good moisturizing to protect our skin from degradation. Diet considerations are extremely important during this time of stress. We're constantly reaching for feel-good foods that are high in fat, calories, and carbohydrate. We should be replacing these choices with fruits and vegetables instead. And don't forget about the importance of hydration and drinking plenty of water throughout the day. You'll certainly feel better. Don't confuse social distancing with physical distancing. Stay in touch with those we trust and love and care for, and stay close to them to get the important social support that we all truly need during these difficult times. If you have further questions, please feel free to contact our office.